Hello everyone, I am Dr. Vibhuti Yadav, Ayurvedic physician, and today we are going to talk about hypertension or high blood pressure. So what is the normal value of blood pressure? It is 120 by 80 mm of Hg. Measure your BP only twice a day, not so many times. It will always fluctuate, and if you are coming by after a walk or after some activity, so then also it will fluctuate. So basically, it should be measured early in the morning, empty stomach, without taking your medicine, and in the evening. So what are the symptoms that you find in BP? The first one is headache or fainting or heart palpitations, sometimes vomiting like feeling, shortness of breath. Hypertension is related to 57% of stroke deaths in India and 24% of coronary heart diseases deaths in India. So, what are the potent factors for hypertension? So, the number one is kidney disease, second is diabetes, third is heart diseases, and if there is dyslipidemia or high cholesterol, or there is stress. So what happens in BP is there is vasoconstriction of the vessels which are taking the blood. So what are the other factors responsible for this vasoconstriction? So the number one is hormonal influence. There are around 15 hormones which influence the movement of blood. Atherosclerotic changes into the vessels. That means the vessels get narrowed by the deposition of fat. If there is more of fat, that is high cholesterol in the blood, it leads to this, and it can lead to heart attacks also sometimes, along with the BP problems. Now I will come to certain food items which you can take for lowering your blood pressure. The number one is amla. Amla can be taken in the form of juice in the morning and evening, 20 to 25 ml. Then second number is Triphala Churna. Triphala Churna can be taken at night, 1 teaspoon with warm water. Number three is Ashwagandha. Ashwagandha is a very good Navine tonic, and in cases of stress it can be helpful. Then number four is Loki juice. Loki juice is bottle guard juice, so that is also very helpful in circulatory problems or in heart problems. So it can be taken with amla also. So Loki plus amla juice can be taken in the morning and in the evening. Then comes Arjuna. Arjuna is a very good herb for the circulatory system, even for heart diseases. So this should also be taken in the form of juice or in the form of tablet or powder. In any form it should be taken every day. And then comes dalchini. Dalchini has very good impact on heart problems and circulatory problems, as I've told you that BP is basically the circulatory problem in the body, and the heart is the pumping organ of the body which circulates the blood. So everything is interconnected, so dalchini also impacts a lot. Then moving on to the lifestyle changes, so of course you need to definitely work on your lifestyle, your diet, your eating habits, eating on time, water intake. So all of that should be taken into consideration. So these were the things which I would like to conclude on BP. And the basic important thing that I would like to say is yoga and pranayam. Pranayam should be taken, it should be done separately, 15-20 minutes in the morning and evening. It really is a very good thing in BP. Some people lower down their BP just by doing these breathing exercises. So I really highly recommend pranayam for your BP problems, for your high BP problems. So if your BP is too high, you can go for medicines also, and you must go for it actually. And along with that, of course, these lifestyle changes and the use of these herbs is definitely recommended. For that, you must contact a doctor, and you must start for the BP medications. So this was all about BP or blood pressure. So if you have any questions about it, you can comment and you can ask about this, because maybe I have missed something. so we can discuss it again. And subscribe the channel, like the video. Thank you for watching.